frequently asked questions when it comes to lip filler. So for number one, what are lip fillers and how do they work?
What are they? It's hyaluronic acid. So basically what we do with lip filler is to enhance a shape or just give you volume. Like for example, if you have very thin lips, then we have to build on those lips with hyaluronic acid. No other material can be done on the lip for volume. So you cannot put biostimulators, you cannot put biopolymers, you cannot do any of that on the lips. Just hyaluronic acid.
Perfect. And when it comes to dermal fillers, what are most commonly used for the lips?
Well, I can be here talking until tomorrow about that, but FDA approved is Juvederm, Restylane, Revanase, Bellaterra, Evolysse, and RHA. But my favorite is Revanase Versa, 100% for the lips. I think it's very unique. Plus, the syringe is 1.2, so you get 1.2 more product of your syringe with your Revanase Versa.
Perfect. And how long do lip fillers last?
It really depends on your metabolism. If you have a fast metabolism, maybe 6 months, but the average is anywhere from 12 months to 18 months. And the best example of that is my lips. I did my lip fillers on December of 2023. So it's been a year and a half since I have done my lip fillers and they're super perfect.
Now, this is the biggest question. Does getting lip fillers hurt?
It can. It definitely can. For me, patient comfort is really important. So I will numb you for about 45 minutes and we use a prescription strength numbing cream, so BTL prescription strength. And then for the most part, patients are comfortable.
And what's the recovery time after lip filler injections?
I would say you're going to be swollen for the first few days. A little bruising is expected because again, it's a needle going into your mucosa. So there is a high chance of bruising, but we try to minimize as much as we can that risk of bruising. We always say don't be kissing anybody after your lip fillers, don't be drinking from a straw after your lip fillers, and just think that those first 2 weeks are gonna be the recovery process.
Perfect. And if so, what are the possible side effects or risks of having lip filler?
Okay, so with dermal fillers, there's always a risk of vascular occlusion. And I think this is something that we all need to talk about because it's not being talked about a lot in this industry. So any dermal filler will have the risk of occluding a blood vessel. We call that a vascular occlusion. And with lips, there is a possibility as the lip artery runs through here and up. If I put product and God forbid that product go into that area, there is a risk I can occlude that blood vessel and cause a vascular occlusion. But we always aspirate just to make sure I'm in a safe zone.
Perfect. And how much filler is usually used for natural looking lips?
Depends on your anatomy because everybody's anatomy is very different. Like someone like myself, I can take a one syringe, no question asked. But then I had a patient this morning. She was more on the elderly side, so she had compromised lips, and I could only do 0.5 cc's on her. So it really depends on your anatomy.
Perfect. And can lip fillers be reversed if I don't like the results?
That's true. You can reverse your lip fillers with Hylenex, which is an enzyme that breaks down the hyaluronic acid that is on the filler. That's why it's really important that wherever you go to get your fillers, they have that enzyme. God forbid, there is a vascular occlusion, we have to revert it, we have the product to do so.
Perfect. And for those who are getting ready for their lip fillers, what should they avoid before getting it done?
Aspirin as much as possible. If you have a history of cold sores, let us know because we will have to kind of pre-medicate you so we prevent as much as possible an outbreak of herpes. So no sun, no aspirin, and try not to take ibuprofen unless you absolutely have to.
Perfect. And who is the patient we have here today? Ah, she's so cute.
She's very cute. She actually, we did soap her lips, and then we're starting fresh. So I'm very excited.
Perfect. And we got Miss